sacrum, I know that if this is the base and this is the apex, that I have two sulci. Right? So I have a sulcus here, a sulcus here. Right? I have two sulci. I know that I have the base of the sacrum. I know that I have the apex of the sacrum. And then I know that I have these corners down here. Right? Inferior lateral angles, if you remember from Kines, we call those. So we're going to say that there are 6 locations that we can actually kind of gain purchase. We can make contact. We can go at the base, that's number 1. At the apex, that's number 2. One sulcus, other sulcus, that's 4. Inferior lateral angle, inferior lateral angle. So there are 6. So it's a 6-step process. Okay? The only thing that you're doing is changing your location. Your performance of these techniques is very similar to what you just did. You're just at your lower, you're on the sacrum, and you're choosing a specific location over that sacrum. Okay? So these are sacroilial. We're on page 17, I believe, in your handout. So these are sacroilial glides, is what we're working on. Okay? And we're going to call this our 6-step, sometimes we call it sacral spring concept. But it's really exactly what you just did. So the skills you were just using in lumbar, we're just translating down into the sacrum now. Okay? So our hand contacts, because these spots are a little bit more distinct, we're going to go with the dummy thumb hand contact. So again, if you want to use the dummy thumb with the mobilizing thumb, or the dummy thumb with the thenar eminence, hypothenar eminence, that's your call. But we're going to use the dummy thumb to make the contact. So you'll see that little diagram there with those 6 spots kind of identified on that sacrum. They're the 6 spots that we're going to push on. Right? So technically not hard to perform, it's just a matter of making sure you get the right spot. So you've got the patient here, you're going to bring them closer to you. Again, always close to you. And you want to make sure that you're on the sacrum. So how do you know that? Well, I'm going to kind of identify that L4 is about the level of iliac crest. I may not know that for sure. If I'm thinking that this is L5 and this is S1, then one way of just quickly doing that is I might just move this leg to the side. So I might just kind of move this a little bit and say, okay, well that's moving. So that's got to be L5. And this doesn't seem to be moving as much. That's got to be S1. So we may elicit some motion there just to get us in the ballpark. Sometimes we just quickly estimate and eyeball it. And we can do that fairly easily because we can see the PSISEs here. And if we just go medial to that, that's the sacral sulcus. The dimple that we all see back there, that's the sulci on either side. So if we find that, which is about the level of S2, and we just come over the center of that, kind of between those PSISEs, that's going to be the landmark that's at the base. Right? So that's at the base, right there. So I'm going to put my thumb there, do thumb over thumb, right? So again, I'm kind of looking over them, right? Do thumb over thumb, and now I'm just doing the same exact technique as I did for my unilateral glide. I'm just over the sacrum. Right? So if you had trouble feeling motion over the lumbar spine, this will frustrate you even further because the sacrum does not move a lot, as we've already talked about. So what am I really trying to ascertain? I'll be honest with you, what I'm trying to ascertain is elicitation of their symptoms. When I'm pushing here, just pushing in one spot may not be enough. So I'm thoroughly evaluating that sacrum in regards to his symptomatic response to passive pressure. That's what I'm trying to tell. Why is this helpful? Well, I might have gone through my lumbar exam and I'm scratching my head, I'm not sure what's going on. I go down to the sacrum and I start pushing on this and I elicit his symptoms that brought him in. Now I'm thinking we've got a sacroilial issue. So again, it has fine-tuned and helped to kind of focus where I think the problem may exist. Once I find the base, then I move off to the side. I do one sulcus, move off to the other side, do the other sulcus. I drop down to the apex, which is right above SC. Right? So I'm on the apex, I'm going to apply force there. And then if I go off just slightly lateral and superior in either direction, that's kind of that lateral inferior border of that sacrum. And I just push there, and then I push on the other side. This is about a 10-15 second deal. I'm not sitting here for a long time really thinking hard and working through this. I'm identifying the landmark, I'm applying a couple pushes, go into the sulcus a couple pushes, sulcus a couple pushes, and then I hit those 2 other spots. Okay? I don't always get all 6. Maybe I'm just going to do some at the base, some at the apex. 6 is kind of the full version of that, which is what I want you guys being able to do. But sometimes we can abbreviate that as we need to. Okay, so that's sacroilial glides, the 6-step sacral spring process.